So what we will be learning today is how to use EFT tapping to reduce stress, as well as we're going to learn the basic recipe, because EFT stands for Emotional Freedom Techniques. When we're stressed, we go into fight, flight, or freeze. And each one is a little bit different, but we're going to focus today more on fight and flight. We go into the stress response when our nervous system perceives something is threatening or could potentially harm us, where we release stress hormones that cause all the physiological changes that you see here. Because we need to run away, or our nervous system thinks that we need to run away or fight something off, we release more blood sugar so that we have the energy to take action. Our blood pressure increases, our pupils dilate so we can be on alert looking for the threat. And our digestive systems actually slows down because the energy is going to our limbs to fight something off or to run away from it. So our body knows, like, okay, this is not the best time for digestion. We need our energy in other parts of the body. The liver converts stored glycogen into glucose, again, the blood sugar. Our lungs dilate because we're breathing more rapidly, or more heavy breathing, and more from our chest as opposed to from our belly. We may start to sweat, and our heart rate increases. So these are the changes that happen, particularly when we're in fight or flight. I like to differentiate that from freeze, because freeze is a bit different. When our nervous system detects that, okay, with this particular stressor, I'm not going to be able to run away, nor am I going to be able to fight it off, then we go into freeze response, which is more of a shutdown, a depression, avoidance, procrastination. Those kinds of behaviors can be a sign of a freeze response. How the mind responds to stress. We have here pictures of two different brains, an unstressed brain and a stressed brain. So when we're in parasympathetic mode, which is rest and digest, in contrast to sympathetic mode, which is when we're stressed, which is again fight, flight, or freeze. When we're in rest and digest, you can see that the prefrontal cortex is very active. So this is where the energy is in the brain when we're unstressed. And so what does that mean? It means that we're able to think clearly. We're able to think logically, rationally. We can problem solve better. We can be more creative. So this is the thinking brain. And when we go into fight or flight, or we're stressed, then the energy moves away from the prefrontal cortex, from the thinking brain, into the emotional brain. And there's a structure in the emotional brain called the amygdala that is really important within the context of tapping. That's kind of the fight or flight alert system. That's part of the brain that detects or perceives that you're under threat. And so that's what sets off the physiological changes that we just reviewed, not to mention that it signals to your adrenal glands to produce adrenaline and cortisol. And so all of these changes take place. And what's super important to know about this is that not only are you feeling those physiological changes in your body when you're stressed, but then these changes in the brain mean that you're not able to think as clearly. It's harder to make rational decisions or good choices. That's why we often turn to unhealthy coping strategies when we're stressed, right? Like what's an example of an unhealthy coping strategy that we might use to try to feel better when we're stressed or feeling bad emotionally in some way? Drinking, very good. Yeah, we may have a few drinks of alcohol, eating or emotional eating. Phones, right? Where we just kind of start doom scrolling on our phones. With any of these behaviors, it's a form of escaping from the stress or the emotions we're feeling, as opposed to processing them. And tapping is a way that we're able to process those emotions. Let's now transition to talk about tapping. And I want to say that the very first time I heard about tapping, I thought it sounded really strange. And some of you may still be thinking that. I started seeing a tapping practitioner that made such a big difference in my life in terms of a lot more self-awareness and a lot of changes that I made in my life that were very positive. That's what inspired me to actually become a practitioner, because I wanted to be able to help other people. And in the simplest terms, it's a stress reduction modality that's in the field of energy psychology. So it combines both Eastern practices and Western in the sense of modern psychology. The Eastern part of it is that we're using the meridian system, which is kind of like the energy system through the body that's used in with acupuncture and acupressure. The psychology part of it is that we're saying certain phrases as we're tapping that allow us to tune in to what we're feeling about certain events or stressors, emotions, that allows us to release them. And so there's lots of research showing the effectiveness of EFT tapping, particularly among veterans returning from war that are struggling with PTSD. And so tapping has been shown to reduce the symptoms of PTSD, but it works on anything that has an emotional component to it. It's also been shown to reduce cortisol, the stress hormone. They've hooked people up to fMRIs, functional magnetic resonance imaging, and they can track the fact that cortisol reduces after a round of tapping or after some rounds of tapping. How exactly does it work? Stress and emotions are a cascade of biochemical responses, and that's electrical, chemical, and hormonal. The hormonal part is the easiest to understand, right? Because we all know that we release adrenaline and cortisol when we're stressed, and those are chemicals. But there's also the electrical system in the body. And so when we tap, it allows us to discharge some of those stressors, negative emotions, and trauma that actually get stored in the body. The reason they can get stored in the body is because, again, when we go into fight or flight, these physiological changes happen to our body that are preparing us to run away or fight something off. But the things that causes stress, too much work, for example, being stuck in traffic, we're not needing to run away or fight something off. And so that stress, that tension that builds up in the body doesn't get discharged. So it gets stored. Tapping and other somatic practices are a way of doing that, to discharge it so that it doesn't stay stored in the body. And so tapping works with the physical body, the emotional body, and the energy body. And when you tap on what are called meridian endpoints, or they're also called acupoints, it literally sends a calming signal to the amygdala. Because remember, the amygdala is like the fight or flight alert system. And so when we tap, it's essentially like telling the amygdala, right here, right now, you're safe. And so the body can calm down and feel a little bit more relaxed. And again, it reduces the stress hormones. And one other thing to know is that when people have experienced a lot of trauma in their lives, going back to those pictures of the brain, the amygdala can actually become enlarged, and the prefrontal cortex can be not only less active, but it can shrink when people have gone through a lot of trauma. And so with tapping, when it's done consistently, I'm not saying just, one round of it or a few sessions, but over time, in people who do it consistently, it can start to rewire the brain. You're less triggered. You're triggered less easily, because when people have experienced trauma, there's a number of things that can cause them to feel triggered, kind of like they're back into whatever caused the trauma to begin with. Do it. How do we tap? We remember and confront a negative emotional experience, and that's similar to what's referred to as exposure therapy. When we then pair that memory or that feeling with a statement of self-acceptance, it allows us to reframe things. And the statement of self-acceptance that is used in tapping is, I deeply and completely accept myself. People often shift their thinking after tapping. So we may be looking at a situation from a certain perspective, and then we do a couple rounds of tapping, and then suddenly like our perspective shifts and we're able to look at the situation from a more positive place. But we have to first focus on the negative. And so tapping causes the intensity of the stress or the negative emotion to decrease. It doesn't mean that the situation externally has changed or that you don't have any thoughts or feelings about it, but the intensity decreases. And that allows us to kind of shift back into our prefrontal cortex and not be stuck in that emotional brain where we're catastrophizing or ruminating or overthinking or just feeling all those negative emotions. Okay, so here are the actual steps. We first identify the issue, and we want to be as specific as possible. We would want to tap on, I have this report that I have to finish by tomorrow, and I'm concerned that I might not have enough time. We give it a number from 0 to 10 in terms of the intensity, with 10 obviously being the highest level of intensity. And then we craft what we refer to as a setup statement. Even though I have this report that's due tomorrow and I'm nervous that I might not have enough time to finish it, I deeply and completely accept myself. We say that phrase 3 times as we tap on the side of the hand. Once we've tapped 3 times there, then we go through the other tapping points, which you see in this picture here. We go to the top of the head, and it's basically just right in the center, top of your head. Then we do the eyebrow point, which is essentially where the bridge of your nose and your eyebrows meet, just kind of right there or right above there. And you can tap on whichever side you prefer, or you can tap on both sides at the same time. And then the side of the eye, which is right where the bone is before you get to the eye socket. Again, one side or the other or both. Under the eye, which again is the bony part right before your eye socket. Under the nose, and there you want to use just one hand because you want to get in the center. Under the mouth, it's also referred to as the chin point, but it's not the tip of the chin, it's where we have this crease. Collarbone, and that's about here. My collarbones stick out quite a bit, so it's easy to demonstrate because it's about 1 inch down and about 1 inch over. So kind of just right below and to the side of. And then we have the underarm point. And that's about 4 inches from your armpit, or for women, about where your bra strap is. So those are the tapping points. So after you've gone through 1 round tapping on all those points, you take a deep breath and you check back in with your body to see what happened to the intensity. And then you repeat if you need to do more rounds. Somebody is asking, how hard do you tap? It's not very hard. It's just a gentle tapping. People often ask how many times on each point. You don't have to count. It's about 7. It's really just long enough for you to say the reminder phrase that is used as you're tapping on each point. Okay, so we're actually going to do our first round of tapping right now. And we're going to do it based on body flexibility. So what I'm going to invite you to do is do a round of tapping with me. The way I do it is that I'm going to tap and say the phrases, and I pause between each phrase for you to repeat it. So what we're going to do is we're going to stand up and reach down to see how far you're able to reach. Maybe you can reach all the way to the floor. Maybe just your fingertips touch the floor. Maybe your hands are able to touch the floor, or maybe you only can get to your knees or somewhere in between. Wherever you are is totally fine. Make note of exactly how far you're able to comfortably reach. And let's go ahead and tap. Even though I was only able to reach this far, my body didn't allow me to bend further than that. I deeply and completely accept myself. Even though This is how far I was able to reach. I deeply and completely accept myself. Even though this is how far I was able to reach, and my body didn't allow me to reach further, I deeply and completely accept myself. This is how far I was able to reach. I couldn't bend further than that. This is how far my body lets me reach. This is my current flexibility. This is how far I was able to reach. I was only able to reach this far. My body didn't let me reach further. This is how far I was able to reach. Okay, now take a deep breath. And I'm going to invite you to stand once more and reach again and see if anything changed. I know for me, the second time I was able to just about put my hands flat on the floor, and the first time it was not quite that far. Who would think that just by tapping, you suddenly become more flexible? But it just shows the power of the technique and how things are stored in the body, and sometimes our beliefs can affect that. It can do so many different things. In fact, let's talk about what else tapping can be used for. It helps with fears. It helps with physical pain. Anything that has an emotional component, and even if there's a physical reason for the pain, once we feel pain, let's say we sprain our ankle, right? There's going to be swelling and pain there while it's healing. But now the fact that we're less mobile can feel frustrating to us, right? So that's the emotional component. And so often when we're in pain and we feel stressed out about it or frustrated or whatever emotions, that can actually exacerbate the pain. It helps with weight loss. It can help with depression, with trauma, including PTSD, like I mentioned. One caveat, though, in terms of trauma, is that that's when you don't want to practice it on your own. You really need to see a certified practitioner, particularly one that's trauma informed, because we use different techniques for trauma. It can help with performance. So some schools have students do it before tests. When we tap, it sends a calming signal to the nervous system. And so we tend to notice these signs of release, like yawning. People sometimes start to feel very sleepy. You might notice that your shoulders are more relaxed, that you feel more grounded, you feel more relaxed or even tired. Probably the most common thing that my clients will say is, I feel lighter. Because when you think about it, stress, emotions, they feel heavy in the body. And then we tap and our body now feels a bit lighter. For those who would like the tapping guide, so here's my email. So there's two freebies that I'm offering. Is you can get the free tapping guide, but for that you'd need to send me an email and I'll send it to you. If you'd like a free ebook that I have, Burnout Prevention, Workplace Assessment for Leaders, that's on my website, so which is liveworkwell.com. If you enter your email, you can get that free downloads. And then for those who can stay, we can do a little bit of tapping. For this round of tapping, I'm going to ask you to, you don't have to share it, just in your mind, think about something recently that caused you stress. And it could be work related, it could be personal. I'm going to use general language. Normally, if I were working with you one-on-one, or if you were doing it on your own, you want to be super specific. But because we're doing group tapping and not individual, I'm going to use more general language. But in fact, what I'm going to invite you to do is to close your eyes and feel your feet on the floor, kind of get grounded. Just tune into your body, maybe take a deep breath, and think about a recent stressful situation, ideally work-related. Be as specific as possible, and you can even visualize what happened, like maybe a short movie in your mind. Maybe it was something you had to do and felt pressured, something somebody said, something someone did or didn't do. And just take a moment to tune into that situation as specifically and as clearly as you can. And then tune into your body and notice what you're feeling. Label the emotion. Maybe it's as general as stress, but maybe it's more specific, like frustration, anger, disappointment, pressure, overwhelm. But focus in on one particular emotion. Maybe you're feeling more than one, but which one are you feeling most intensely? And where do you feel it in your body? And now that you've zoomed in on that, identify your number 0 to 10 in terms of the intensity. And once you have all of that, when you're ready, open your eyes. Okay, so make a mental note of your number. And let's go ahead and tap. Again, my words are going to be general. When I say general things, I want you to, in your mind, think the more specific thoughts about the situation or the feeling. So again, I invite you to go ahead and tap with me. I will pause between phrases for you to repeat it. Even though I feel this stress in my body, when I remember this work situation, and I deeply and completely accept myself. Even though I feel this stress in my body, when I think about this difficult situation at work, and I deeply and completely accept myself. Even though I feel this stress in my body, just remembering this challenge at work, and I deeply and completely accept myself. This work stress, this challenging situation, I feel this stress in my body. This stress in my body. This stress from this challenging situation. This stress about work. I feel this stress in my body. This stressful work situation. Take a deep breath. How many of you noticed a change? What was your number before and what is your number now? Here is my contact information. If you are interested in that tapping guide, be sure to send me an email. And if you're interested in the burnout prevention workplace assessment for leaders, hop onto my website and enter your email address so you can download that. You can also feel free to follow me on social media, on LinkedIn, on Instagram. And with that, well, thank you so much.